Hello, this is Dr. Richard Bernstein with session number 6 of Dr. Bernstein's Diabetes University. Today we're going to talk about exercise, and we're going to deal with a narrow subject, namely what kinds of exercise are of value. Exercise is of special value for type 2 diabetics who are overweight and insulin resistant because it lowers insulin resistance. In fact, exercise moves the GLUT4 glucose transporters that we told you about in a prior session, just as insulin does. But exercise is of value to everybody, not just type 2 diabetics. Why? Well, for one thing, it extends life. Even if non-diabetics exercise regularly, they live longer than do non-diabetics who don't exercise. There's also the matter of telomeres. You may recall from a previous session that telomeres are extensions on our chromosomes, and we lose a telomere every time a cell line divides. So our lifetimes are limited by the numbers of telomeres we have on our cells. And there are relatively few things that you can do to increase the number of telomeres on your cells. But one thing that's very effective is strenuous exercise, especially muscle building exercise. And we're going to talk about that in just a moment, but I want to mention that for people in general, not just diabetics, you want to give people an exercise that they will do. So if someone says, I like to play soccer, and that's the only thing I'm interested in, he should be encouraged to do that. When I was a kid, I loved to play tennis, and I had no interest in doing anything else. Because of other problems, I can no longer play tennis, but I can do bodybuilding exercises, which are very effective at lengthening telomeres. So I'm going to go over what I think are the most effective methods for building muscle. I'll first go over the system that I use, which has been reinvented a number of times. Each time the inventor gives it a different name. It's been called Body by Science, the Slow Burn, and Powers of 10. I know of those three names for the same system. And the system goes like this. Ideally, you go to a gymnasium that has exercise equipment because it's safer to use machines than to use, say, barbells. You ideally would use equipment with eccentric cams in the system, such as Nautilus-made equipment. This is because as you do a movement for an exercise, let's say that you're doing a curl where you move your arms like this. At the start of the curl, it may be difficult to lift a heavy weight. In the middle, it may be the easiest, and then depending upon where you end, it may get harder again, or it may get easier. But these systems that have cams in the machine that know where you are in the motion make the effort greater or less depending upon where you are in the motion. So you get uniform resistance throughout the motion. So that's ideal. But if you can't afford to go to a gym or it's inaccessible, you can use things like dumbbells. You can even buy your own weightlifting machine and so on. But I'm going to go through the system. And the system is to spend at least 10 seconds on every lift and at least 10 seconds coming down. And you pick a weight that will tire you out after 60 to 120 seconds. That's after 1 to 2 minutes. So if you're doing this kind of lift for, let's say, 90 seconds, and you can't budge, you can't move your muscles, you've done an effective job. And you do what I do, you write it down, and you write down the weight that you used. And then you come back a week later. If you are doing this with a heavy weight, you will put so much work into your muscle that it needs a week to recover. You actually break muscle fibers when you're doing this strenuous anaerobic exercise, and you want to give the muscle a rest for a week. Ideally, you should, over the course of the week, exercise every muscle group of the body. I attempt to do that, so I go to the gym several times a week. And I write down the amount of time I spend doing a certain exercise, and then I also write down the weight that I used. And I look at it the following week in the hopes that this time I'll be able to lift for a longer period of time. Now, how do I know how long I've been doing the lifting? Well, I have a timer. This is called Everlast. And I just have to reset it to 0. And the reason I like this Everlast timer is because it makes a loud noise. And remember, I'm 80 years old, I'm a little hard of hearing, and I want to make sure that I press the button. So if I hear a loud noise, I know I started the timer. You'll hear it. And after I've done my lifting, I push the button again. This time it doesn't make a noise, but I get the total time readout, and I write it down. And I try to exceed that time next week. I'll show you the sort of thing. Each column represents a different exercise, and this is something like 25 or 30 exercises that I do in the course of a week, and I do them each only once, but I do them so hard that I need a week to recover from that exercise. The other kind of exercise that I like is cardiovascular exercise, which I will talk about in the next session. One more way of exercising that's more effective than what I do, but requires a second person. This is the use of negatives. It requires what we will call a trainer. Now, the trainer need not be very experienced. In fact, a small kid can be training a large adult very effectively. And the way to do this is have the exerciser lift a weight, let's say 10 times. The amount of weight has been selected so that the exerciser will be wiped out after 10 lifts. Let's say, for example, that we're talking about a bench press, well, let's call it an overhead press, which goes like this. So you're doing this 10 times, and you finally get to a point where you can barely hold it up. And you never lock your joints. You don't lock your elbows when you do these exercises, because that's like cheating. The locked elbow holds it up. So you're holding it there, and the trainer says, now hold it there, and he comes along and pushes on the bar that you're holding, making it harder and harder for you to hold it. And eventually you collapse under his pressure. That pressure is called a negative. He's pushing down while you're trying to push up. And he'll now say, okay, one more lift. Well, you're exhausted. You can't get it up, but he's going to help you. He's going to put his hand under the bar and help you get it back up there again. And he'll again say, hold it there. And you'll try to hold it, but he'll come and press on the bar, giving you another negative, and you collapse under his pressure. Those last two negatives are far more effective than the first 10 lifts that supposedly tired you out. Your muscle had used up its available oxygen, was now operating in an anaerobic range, which is the most effective for building muscle, and he's forcing you, with his help, to operate in the anaerobic range. So, if you can get somebody to act as the trainer, you'll get even more rapid results than you do with the slow burn system that I first described. I might add that if you use either of these methods and you keep a record of the weight and the time, or in the second situation just the weight, you will see that you rapidly get stronger. And this is very encouraging. Another advantage to this kind of exercise is that you will look better. Not only will your physique look better, but as your telomeres grow, your skin looks better. So if you're elderly like me, you'll have younger looking skin, and even your memory will improve. People who exercise regularly and strenuously rarely get Alzheimer's disease. So good luck, thanks for listening, and come back for session number 7. The bulk of what you've heard on this video appears in my book, Dr. Bernstein's Diabetes Solution, which is available at most internet and local bookstores. It is published by the Hachette Book Group. I'd like to remind you that we have monthly free teleseminars every month at the site askdrbernstein.net. Doctor is spelt DR, so askdrbernstein.net for a free monthly teleseminar. Sign up a day or two in advance so that you get a reserved seat. Good luck, and thanks for listening.